Hello, everybody, um, and welcome. And I'm just so extremely excited tonight that everyone is coming along and interested in this topic. So I'd like to introduce to you our consumer health advocate, Linda Beaver. Now, Linda's experience in the health sector is extensive and varied, from clinical practice to education and management, but now her role has changed. And Linda is all about empowering health consumers to become more engaged, informed, confident, and aware of what we should all expect as we navigate the complexities of the health system. We will be chatting about how you can be more informed about your pain, how to describe it, monitor it, and be a better participant when discussing it with your health consultation. So welcome, Linda. Thank you for coming along.
Thanks so much, Maree. It's great to be here tonight. This is a really important topic also. Pain is one of those things that we all experience, and the statistics tell us that it's the key reason people seek medical advice. So to be able to talk about how we can all enable ourselves and our family to be a little more aware of what our pain means to us is going to mean that we can then talk about it with more confidence when we start that conversation with our healthcare practitioner. Now, that might be the doctor, it might be the physio, it could be the specialist, it could be, the osteopath, it could be the podiatrist, it could be any number of health practitioners that you might consult about pain. So the most important thing is to recognize why we need to know about our own pain. And the reason is it's simple, because pain is a different perspective for everybody. We all have different wants and needs when we think about our pain and how it's going to be managed. So pain is very personal, and that's probably the biggest issue, because what I might regard as being an excruciating pain could be something that is really well tolerated by the next person. So we need to be pretty cluey about how we interpret and relate to our own pain. So could I have the first slide, please? So in this image, it just puts into perspective where this pain profile or awareness fits into the big picture of healthcare. So pain for us is very personal, and it's a very individual experience. But we need to be able to assist our healthcare practitioner understand what our pain is all about, because their perception could be really quite different. They could have preconceived ideas about what it means if you say, oh yeah, look, it really hurts, or oh yeah, when I bend over, I get pain. Whereas it might not be a true representation of what your pain is really saying. So we need to be able to share that information in a way that's meaningful. Otherwise, it complicates the issue and the potential management, because ultimately your healthcare practitioner is going to be the one that listens, takes notes, investigates, considers all the information about the way we describe our pain, and then make decisions about a diagnosis and management. So if we can't get that message across properly, then we are compromising the potential for our successful treatment or management. The next slide, please. There are always a number of things that I think are very important when we start to think about our personal pain. And I work on a pattern of, the rule of fives in so many areas of health advocacy and information that I've developed for healthcare consumers. There always seem to be 5 key points. And in this instance, I've got 5 important things about your pain. So firstly, know where it is. Be able to describe it or identify it. Think about it when you get pain. It's very easy to be caught up in pain, and then you find that really what's happening is you lose sight of where that pain is actually occurring. So the next thing, the next slide, please. The next important thing is, when does that pain occur? Does it hurt when you stand up? Does it hurt when you wake up in the morning? Does it hurt when you bend over? Does it hurt when you walk? Does it hurt, when you sit down? If you sit too long at the desk, does it hurt if you drive for any great distance? Or does it just hurt at any time? Or is it there all the time? That's really telling information. So when you're describing your pain to your healthcare practitioner, having that little bit of information can really help in the appraisal of what you are trying to say about your pain and the experience you're having as you endure your pain. The next slide, please, or the next point. So an important thing is, when did it start? Now, I don't know about you, but I can absolutely assure you there are so many occasions where you'll be asked, so when did that pain start? Oh, yeah, well, look, now, was it there last week? I can't remember. Now, hang on. When I had that meeting, I couldn't sit in the chair for too long. It's very difficult sometimes to be able to pinpoint exactly when pain happens and when it starts. But that's really important information, once again, not only from the health practitioner perspective, but also personally, because it helps us when we're thinking about our pain to put it into perspective. So when did that start? What was I doing? That could be an indication of a trigger factor that maybe hadn't been considered before. Next point, please. And what does it feel like? So pain is one of those things that can represent itself in a myriad of different ways. It could be sharp, it could be dull, it could be throbbing, it could be an ache. It could be everywhere. It could just be completely horrendous, nagging, dreadful pain that it seems unrelenting. Or it could be quite specific. It could be sharp, stabbing. It could be a numb or tingling sort of pain. So many ways to describe pain. And that's incredibly important because it will help to differentiate different types of pain and where it might be coming from. Is it muscle pain? Is it nerve pain, etc.? Next point, please. So what makes it better or worse? Is it medication? Is it exercise? Is it doing nothing and resting? Is it elevating that leg that might be causing you some pain? So many things can make the pain better, but so too there are lots of things that can make it worse. So if we have the opportunity to think about these things and write it down or document it in some way, this is giving really valuable information to the healthcare practitioner about what you present with when you talk about your pain and where that fits into the whole clinical picture. Often there are really quick judgments made about someone who comes in and talks about pain, and it might not always be an accurate assessment. So to be able to offer this level of specific information about how you feel when you're describing your pain can be absolutely vital when there's management or treatment plans being considered. Next slide, please. So I talked a little bit about what does it feel like, and these are just some of the things that you can use to describe pain. These are the sorts of things you can write down or note when you're describing the way you're feeling when you're experiencing your pain. Is it cramping, aching, tingling, shooting? Is it a tight, constricting sort of pain? Or is there a stinging, a burning, a crushing? Is it excruciating? Is it occurring in a specific area? Or does it radiate or spread in any way? All these are really good clinical clues. It mightn't mean much to you, but it can be really telling for the health practitioner. So if you can identify the sort of pain that you've got when you're experiencing it, what you can do to make it or better, or things that might make it worse, when it started, how long it's been there, all that's really powerful information to help a diagnosis be made. So it's giving that healthcare practitioner really strong insights into what your pain is all about. Next slide, please. So one of the things that is also really helpful. And sometimes health practitioners will have a pain chart or a pain scale or a document that you can use to identify where your pain is. Because sometimes it can be pretty tricky. You know, you sort of go, oh, yeah, it was really bad. Oh, well, no, hang on. Was it the left side, the right side? Hang on, I've got to do that movement again to see just where the pain starts. If you've got a little diagram or a picture or even a stick figure, it helps, because sometimes pain comes and goes. Sometimes we discount it. You know, if you've been out in the garden all weekend pulling weeds out and digging garden beds, of course you're going to get pain in your back, potentially, or you might get sore knees if you've been, crouched down on the ground and pulling out weeds. But if it continues, is that the only reason it's there, or is there something else going on that's been triggered by that activity? So knowing where your pain is just as important as knowing how to describe it. So sometimes a little cross or a dot or a circle on a stick figure or something like this can be incredibly valuable also. Next slide. So one of the things that I think is very helpful, and in my experience has been very helpful, is having a pain scale. Now, once again, health practitioners may well give you something like this so that you can mark where your pain level was on a given day. This is particularly helpful if you're on a medication regime to manage acute pain, if you're on a chronic pain management plan. If you keep a record of where your pain level is at each day, or if you make a note that says, today I didn't walk and my pain was worse, or today I went to the pool and I swam and my pain dropped back to a 5 out of 10, then that's telling over a period of time about the way in which your pain reacts and responds to activities and or some of the management that might be in place as well. So having these resources can be one of the biggest benefits to you, to me, to all of us as healthcare practitioners, as health consumers, to assist our healthcare practitioners reach decisions that will be of benefit to us. And it also helps to reinforce treatment options. And I guess one of the important things is to be clear about what treatment option is preferred. Do you want to go down the medication pathway or explore other ways of managing pain? Is exercise something you would prefer? Does medication work, or will exercise relieve it? Or will there be an opportunity for you to change lifestyle, introduce some behaviors that can minimize the pain you're experiencing? This is the sort of thing that you can ask your healthcare practitioner and get a really clear insight into what they can offer. But sometimes if you don't ask the question, the traditional treatment plan might be put in place. So I want you to go on some medication, we'll try this and see how it works. Or I want you to, go off and see a physio and get some exercise. Or I want you to go and get tests done. Those options might be appropriate, but it's really important for all of us when we are in this situation of trying to identify, understand, and describe our own pain, to be aware of what we want to get out of any treatment that's on offer. Sometimes our perceptions can be a little bit different to the perceptions of our healthcare practitioner. And I had one person who told me her story about getting some back surgery, and her specific goal was to get out of pain. The surgeon's specific goal was that she would get more movement in her back, and isn't that fantastic? But I'm still in pain. Oh yes, but look at all the movement you've got. That's a really good outcome. It's a different perception. What we want to see as an outcome from our pain management has to be driven by us. We are the ones that suffer it, and we will be the ones that can help determine how effective the treatment is going to be by working with our health practitioner in a very informed and confident way. And that confidence will be built by the opportunity we have to be aware of our pain, what it means to us, and how we can best describe and manage it. I think overall, the important thing is to understand that as a health consumer, a patient, a carer, a family member, we all have a responsibility to try and improve the outcomes for our healthcare by taking that little bit of extra ownership, by taking more responsibility for being confident about what our problems are. And pain is a key indicator of a physical issue that may need some significant intervention. It may need some moderate intervention, but we need to be involved in a very active way in how that plays out as far as our treatment's concerned. So having access to information that we have about our pain and taking ownership really is a driving force. So I hope that gives you a little bit of insight into some of the ways in which you and I can take a little bit more control and ownership about understanding and recognizing what our pain is all about, and being able to pass that on in an informed and confident way to our healthcare practitioners. Thanks, Maree.
Thank you, Linda. That is so insightful for our community, and they can take on board these suggestions and the way you've described it to use their own information and be in control of it. And I guess the next question that some people may have is that the whole world has moved to a digital place. We have not only people reverting to using telehealth, but also physical appointments. So how does the consumer or the patient communicate their information about their pain in this new world? So I guess this is the question of how do you track your pain, own it, and be in control of it? And so what we have in this next screen is some examples of how Wanngi helps you to do that. So if we can provide this next screen. So when you're managing or communicating, Linda talked about documenting your symptoms and being able to communicate them at your next appointment. And here we have some examples of how you can do that within Wanngi. It's about providing the information, when and how it happened, using a pain scale, as Linda subscribed to, or you can simplistically describe it. So this is the way that you can manage this in a digital way. The next step, of course, is how do you communicate this at your next appointment? And what you can do from Wanngi is at the press of a button is extract and export your health history and your symptoms and provide it to the doctor at that appointment. It's very simple to do, and it's all about you feeling in control and being part of your solution. So the next thing we have is we have a number of questions which we have from the audience, and we'd like to go through those. But if you have any more, please put them in the comments. So we'll move to those now. So the first one, Linda, is what do I do if a doctor doesn't ask me questions about my pain?
Well, that's a tricky one, because ideally, if you go in with a primary complaint, the response to, and good morning, Linda, and what's brought you here today? How can I help you? Say, well, I've got this pain in my back. Okay. So sometimes that can be a very superficial coverage, shall we say, of what that pain's all about. So it might just be, oh, yes, so when did it start? Oh, well, I don't know. Okay, so what's the pain like? Oh, well, it's sore. That sort of response is not going to drive an interest and inquisitive interaction with the doctor. So if the doctor's not really drilling down into what your pain is all about and your symptoms, just take over. Just say, look, I really need to tell you about this. And if you've got something written down, if you've got it in your phone, if you've got an app, if you've got a piece of paper, bring it out and say, look, I'm here about my pain. We need to talk about it. Because so much of the health dialogue and the health system these days is driving us as patients to be far more interactive and far more in control of our own health care. So that's going to change when we as the health consumers start to say, now hang on a sec, I'm here because I've got a pain in my back and I really need to talk about it and I need to tell you all about it. So let's start this conversation. Because sometimes time and money drives consultations and there's not always the opportunity for it to be extended to get a lot of information. So my great advice to everybody is to be one that wants to take a little bit more control and say, if you're not going to ask me the questions, let me give you this information because I need you to help me, but you can't help me unless you know what's going on. That might cause a, okay, response and reaction. But, this is the way it has to be if we really want to be comfortable and confident about the healthcare we're receiving.
Now, thank you, Linda. Now, the next question is interesting because we understand that this is a change in behaviour for not only consumers, but also clinicians as well. And so we're just wondering what happens if the doctor just tells me what to do?
Yeah, and that does happen, and that's not an ideal situation, but it's quite traditionally been the way a healthcare interaction occurs. We've had a culture of do as I say in the healthcare system, and we are being told by the government departments, by the health industry, that we need to take a little bit more control of our health and be more active in our discussions about it. So we now need to say, no, I need to talk to you about options that might suit me. And pain management is a really complex issue in some cases. And so while there might be some really great and considered thoughts about what would work best for you, it actually might not work best for you. So in that situation, you have the opportunity and you also have the right to say, I don't want to just do this. I want to talk about what's available and how best I can be involved in my own pain management. And so this is the two-way street of the dialogue. Unfortunately, it doesn't always work particularly well, but it's only by each and every one of us being prepared to say, now, hang on a second. Look, I really need to talk to you about this. I don't want you just to tell me I have to take a tablet or go on medication. I want to know what else is available and what else can you offer me? Or if you can't offer me, where else can I go to get some advice? Because I need to be able to work through this to suit me and my needs and my life as well. Now, this is, obviously where there are very acute issues and serious medical issues that needs to be changed, but still communication and active interaction is really important. So yes, it is a two-way street and it's a learning curve on both sides of the equation.
Thank you, Linda. Now, we're aware that it's not always a clinical visit with just us. So we're taking a community, the community often takes someone they care about to the doctors. It's also, they may have a carer role, so they're taking an elderly person or a child or someone with a disability. So what do we do here? This person says, I get confused when I talk about my child and their pain. How can I make more sense?
Yes, a sick child or a child that's distressed and obviously in pain can be a bit of a mystery because often it's a situation that can't be well described. I think in these situations, putting in place the simple documentation processes or recording information about a child, and it depends whether it's a baby or if it's a toddler or a young infant, who may or may not be able to react and interact or describe or respond to information or questions as to how this would be handled. But, you know, if you can keep a record or a note that indicates that, oh gosh, you know, my baby's really unwell at a given time or something triggers it, then that helps, because when we're in a very emotional situation, and having a sick child can be incredibly draining, and parents may well be sleep deprived, to be able to recall the information that is meaningful to your medical practitioner is really difficult. So it's all about keeping a track of what's going on. You know, and it might be, if I do this, or if I, you know, pick up my child, he screams, that's telling, right? That's information that's worthwhile. So make a note of it or record it. And then that's still painting that same clinical picture that's going to help provide detailed information that will be of value to the health practitioner assessing that sick child.
Thank you. Now, the next one. The doctor just tells me what to do, and I take the stuff if I think I need to. I don't know what to ask. The doctor knows what I need.
Yeah, well, this is very much the do as I say culture of, I go to the doctor, I tell the doctor I'm not well, the doctor tells me what to do, and I go away. And yeah, you know, I don't really want to do that, so I won't do that. Or I don't want to take that tablet, or I can't afford it this week, so I don't bother. It's all this communication. You know, it's the situation we face on a regular basis, where if there are questions that should be asked, a little bit of preparation helps enormously. And, you know, we don't always prepare for these things. But if there's a situation such as this where someone goes along, doesn't really know much about what's going on, but I know the doctor's going to fix me, and the doctor can't get very much information out of that person because they don't really know what's troubling them in any great detail and just expect a miracle cure, there are these speed bumps all the way along through that conversation and that consultation process. So thinking about why you're going to the doctor, having some questions prepared makes all the difference. And it might just be really simple things like, I really don't want to have to take any more tablets. What else can I do if I have to have treatment for this? You know, or if you're going to send me off for more tests, I can't get there. It's too expensive. I live, you know, a 3-hour drive from the radiology practice. So I just need to know what I can do, but I need to know, if you're going to send me off for stuff, why? Just so, you know, I understand, because it's not easy. So these are all the sorts of little preparatory things that can be considered. But it's also very easy to say, I'm going to go to the doctor and the doctor's going to give me something, fix me, and then I'll, you know, if I feel okay, that's good. If I don't, oh yeah, I forgot to take that medication, but I'm okay today, so I won't bother. So it's that whole two-way street of communication comes to the fore again. Expectations, preparation, and outcomes.
Thanks. Now, I think that's a great lead on to this next question. And many people also have concerns about the cost of healthcare. Not everybody. I know we have, you know, some areas we have free healthcare, but for many people, they may not have health plans. And so I think this next question is relevant. I told my doctor I had pain behind my knee, and he just sent me off for scans. No questions. It seems a waste of time to be prepared.
Yeah, sometimes that diagnostic test or investigation is a bit of a shortcut to an outcome that might not be absolutely essential as a diagnostic tool. And it is important. And as a patient, we need to be prepared to say, why and how much is that going to cost me? Is this the sort of thing that's going to make a difference to how you treat this problem for me? And if not, then do I really need to go and have that test done now? And this is a situation we encounter. I live in a rural area, and to get some of these investigations, like a scan might be a 2-hour drive. So no public transport, there's fuel costs. If I've got pain behind my knee and it's the right knee, I might not be able to drive comfortably. There's a whole flow-on effect in these situations. So cost is certainly something that we need to consider, and access to services is another big thing that we need to consider, because not everybody lives in an urban area with a whole array of really effective health service providers available to them. Once you get outside that city boundary, it's then a considerable issue to access many of these diagnostic services. So knowing why we have to do it's a really important thing. And we need to be prepared to ask the question. It's that empowerment from our viewpoint and that confidence to say, you know what, please tell me, why do I have to, what difference is this going to make in your diagnosis and management?
Now, I think this same question is in the same, vein. So I said my back was killing me, so the doctor just sent me for x-rays. Didn't ask many questions, just how long it was sore, and was I taking any pain meds?
Yeah, it is very similar. It's okay, I don't really know what's going on here, so I'm going to send you off for x-rays, and that will tell me lots of important stuff maybe about what's going on in your back. Sometimes that's just a matter of saying, again, why? Like, what is this going to do to help me? Is there something else that would be of benefit? Could I go to a physiotherapist and get some exercises? Is there benefit in me going off and doing some water exercise if that's available? We can be the prompt. We can be the person that helps to extend the potential for our treatment options by asking these questions. And it's really, again, a matter of feeling more confident to say, really, do I have to have an x-ray? Isn't there anything else that I can do that might help at the moment? What can you offer me? And that's often a pathway that can be explored a little more fully.
And I guess, what we've seen over COVID is a lot of services actually haven't been available, and people have also had to resort to telehealth, and it's been quite difficult for some people. Now, we've got a question here from the audience. I'll just read it out. Everyone can see. Wonderful presentation, Linda and Maree. Generally patient-centric approach to pain management using Wanngi. Such a shame a patient has to press for more than take 2 Panadol and go home and rest, so to speak. Do you think rating the doctor, especially using telehealth, will help ensure the practitioner stays focused on addressing the pain issue?
Rating the doctor, that's an interesting thing that's been discussed at various levels of health service provision, and it's a tricky one, because like everything, we all get on better with some people than others, and so sometimes rating the doctor isn't always something that gives a true reflection of the doctor's interaction and diagnostic abilities. But it's something that we should be confident enough to feed back to the doctor or the practice. If we're not happy, I probably shouldn't digress on this, but there's a phrase that we use quite a lot in scouting, and I have a strong connection to scouting. And the phrase is, and it applies just as much in this situation, the behavior we walk past is the behavior we accept. So if we're prepared to accept the, take 2 Panadol and go home and rest approach to our healthcare, then, we really shouldn't complain. But if we're prepared to then say, hang on a second, that's not going to work for me. I really need you to offer me more through this consultation what else is available, then we start to see some change. And I know in my own situation, it can be quite confronting when, as the patient, you say, no, that's not going to work for me. What else can you offer? And it's, this, what do you mean it won't work? Well, everybody's got a backstory. Everybody has a lifestyle. Everybody has home dynamics and workplace situations that impact on how they can manage their health. If you're not asked about what's going to work for you, then that level of insight is not available to that healthcare practitioner. So sometimes you just need to go, no, it's not going to work. So what else can we do? And this is the reason it won't work. I live out of town, so I've been told I need to exercise more. Great. No public transport, cars off the road. What do I do? How do I exercise? We'll go to the gym. No, I don't want to go to the gym, right? I don't like gyms. I can't afford to go to the gym. There could be all sorts of reasons that dictating type approach isn't going to work, but we need to be prepared to say, no, it's not going to work. So let's talk some more about this. And that's where you start to break down the barriers, and that's what starts the conversation. And that conversation is really important. So, the take 2 Panadol and go home and rest isn't always the best solution. So be prepared to say no, but also be prepared to say no. That won't work. It's not so much a matter of ranking or rating as much as being proactive in the conversation and the dialogue. Otherwise, the messages won't get through.
Yeah. Now, I think this is the last question, but there might be others come through. I think most people feel very vulnerable when they go to the doctors because, they're obviously not well. And often the most educated people just really don't feel like they can ask questions. And often they don't actually understand what the doctor is saying because I think they feel like the doctor is talking in another language. So, or the medication, they don't know the medication, they can't even remember how to spell it. So I think simplistically, how do I ask to have the explanation in plain language?
Just like that. I can't understand, or I don't understand what you're saying. Can you explain it in another way? Can you provide me with some resources that will help me understand this? What do I do to get a better insight into what this means for me? And it's really challenging because there is a sub-language in health that's full of jargons and itises and ologies and abbreviations that we don't get. And yes, there's this perception in the health industry that if you're very well educated, of course, you'll understand all the health information that is given to you. And that's poppycock, to put it very bluntly, because there's so much stuff that's said, terminology that's used. You can be a highly educated person and have no understanding or interest in health at all. So we have to be prepared to ask for things to be explained in a way that we can understand. And that's very reasonable. Writing health material these days, the age that we try to write information is set at a grade 6. That's a 12-year-old. And making information usable, readable, easy to understand is very important. So we don't want to have the long explanations, the wordy dialogue and so on. It just needs to be short, simple, respectful, and using words that we understand. I laugh about the fact so often I get this reminded about getting some eye drops at one point. And I picked up this packet of eye drops, or this little dropper bottle, at the pharmacy, and I looked at the instructions on it, and it said, instill on left side. And I thought, okay, now I'm a fairly well-educated person. That's really bizarre terminology to give on an instruction to put eye drops in your eye. Now, the other thing related to that particular incident, my own experience, was nobody actually asked me if I knew how to put eye drops in. And when I was able to see again, I looked and I'd been doing it the wrong way. Thank God for video and YouTube, because I found out I'd been putting the eye drops in completely incorrectly, but nobody had asked if I knew how to do it. So that's the other thing. Is if, oh yes, look, I'm going to prescribe this for you, or I'm going to, tell you how to go and buy a brace for your knee at the pharmacy. Okay, so how do I use that? How much is it going to cost? How long will I have to do that? And those are then the flow-on questions. What impact is that going to have on my pain? And so it flows on. It takes a long time to be confident and feel able to not challenge, but engage in a conversation and not just sit there and be told what to do. So I've gone off track there, but language is really important. And that language of instill on left side, to me, was like, really? Couldn't you have just said, put eye drops in the left eye? That to me would have been far more sensible. So language is very important. And we need to ask for language that we can understand and not feel self-conscious about not understanding the medical jargon.
Now, I have a last interesting question is, how do you think people will feel the first time they go to an appointment and they feel like they're very confident about how they're communicating? How do you think they'll leave that appointment?
Oh, what a wonderful question. I would hope that they walk out of that consultation feeling that they've achieved something very positive. Now, that will be purely and simply based on how the other person in that conversation responds and reacts. There can be, and I'll quote this story too, a situation where a lady had to travel quite some distance to get to see a specialist, and she got into the specialist appointment and was kept waiting for over an hour with no advice from the receptionist that it was going to be that length of time. She was feeling very tired, very stressed, very uncertain, very anxious, got in there, and the person she was seeing sort of did the cursory, yes, hello, Mrs. So-and-so, come in, take a seat, and sat, and this is one of the downfalls of technology, sat at the computer and started reading reports and so on, and just not even engaging with eye contact. Said to this woman, so why are you here and what's going on? And he's still looking at the computer. And she was so ropeable. She said, stop and look at me and listen to what I'm saying. And she said he just sat back in shock and looked at her and connected. And I thought, and she was so embarrassed. When she was telling me this story, she said, I felt so embarrassed, but I was so frustrated by the way I was being treated in this. And I just needed him to look at me and listen to what I was saying, not focused on what was on the screen. I hope we don't have to go to those steps with our consultations, but sometimes it's necessary. It's almost like the bit of a shock to say, you know what, this just isn't good enough. Listen to me, look at me, talk to me, connect with me, and we can sort this out together. I respect and rely on the advice you can give me, but you also have to respect and rely on me as the person that is here for a reason that is related to my health. And I can't always do everything you think I should be able to do, so we might have to modify it a little bit. So that preparation and that awareness that perhaps there's a different pathway to that health outcome could and maybe should be explored is a very real option that we need to consider.
Well, I will be so excited to hear back from our audience the next time they do this. I mean, imagine that. Imagine if they go to their next appointment and they use these methods we've talked about, they take along their information, they communicate it effectively, and out of that, a more effective diagnosis and a feeling of empowerment.
Yes.
There's no losing there, is there?
No. It's really bringing personalized treatment mapping and treatment planning into that healthcare process. You know, if you can be confident and know what you want to try and get out of the consultation and know how you want to be able to provide information that's going to help that healthcare practitioner establish exactly what's going on, it means an enormous amount to the effectiveness of treatment, the cost effectiveness of treatment, access to treatment, and all the other elements related to it. It's positive. It's great. It's something that I think we should all strive for. And look, I still fall by the wayside at times, but it's just that constant reminder of let's be prepared. Let's know what in this instance, our pain is all about, because then I know that I can help to direct and drive my recovery in a really informed way. So it's a win-win.
A win-win. I was just going to say that. I think on that note, our audience, what we're leaving you with is a win-win scenario. So, so thank you so much, Linda. I am sure that our audience is extremely grateful for all of the insights you provided today. And we look forward to hearing their stories. So if they can communicate to us through Facebook of how they went in the next appointment, we'd love to hear their stories. Thank you.
Yeah, that would be wonderful. Thanks very much, Maree. I've thoroughly enjoyed the evening.
Okay, thank you. Bye.